yeah, that is much easier.
There you go.
Oh, that's better. All right. That's good. Well, I injured my knee by lifting. Well, I didn't realize it was connected to my low back, but I lifted up a big old printer, and I lifted it up, and then I realized didn't have a place to put it. So I twisted a little bit, looking for a place to put it.
To the left? You twisted to
I
the left?
twisted to the left. And then I found a place and I put it down. It did not hurt for 2 days, really. So I thought it was fine. But then really the first symptoms were my low back started to hurt. And then it went to my knee, where it was very, very sore. It was almost impossible. It's impossible to go downstairs without holding on, which is very unusual for me. Going upstairs is easier, but going downstairs, it's very painful. It's also a little unstable. If I'm walking, I'm a walker, and if I'm walking and there's a bump on like a sidewalk or the dirt, then I can just I will just have to catch myself. I think I'm not even lifting my feet as high as usual, because I find myself even getting stuck on any kind of the carpeting is a little thicker, and I find myself just my foot sticking to the carpet.
Since you injured it?
Yes, since I injured it, yes. And so sometimes at night, there's been a couple of nights where it has just been throbbing. Really, I wake up and it's throbbing.
Right.
Maybe if I did a lot that day, and I've been moving, we've been moving some boxes, and so any kind of extra exertion during the day, at the end of the day, is sore. Yeah. And like today, it's pretty sore, and I'm struggling to navigate stairs.
Have you done anything already, like ice or medication?
I did ice once, and it was helpful. No, I haven't taken any medication. It hasn't been that bad, and I don't usually take medication, so I haven't taken anything for the pain. And it's mostly just mobility. It's really hindering my mobility. So that's about it. I can pretty much connect it to lifting that printer.
Yeah.
So
does sitting make the knee worse?
Sitting makes my low back worse, but doesn't necessarily. No, it doesn't. Yeah. That's about it. My low back pain is really not that noticeable until you palpate it, and then you can feel it where it hurts.
Yeah.
But just everyday stuff, it doesn't hurt.
But it did at first.
Well, yeah, that was my first symptom, about 2 days after.
Did you see a chiropractor for that?
Yes.
Okay.
Yes, I did.
Okay.
Yeah.
With the knee, we took some x-rays of that knee. We found that you had turned it this way.
Okay.
You turned the tibia, which is this bone right here, you turned it that way some. And so in terms of adjusting it, it needs to come back this way. And the meniscus has little grooves in it, and those grooves have to line up. And when those grooves don't line up, it swells and hurts.
Yeah, it is it has been swollen.
Yeah. Right there. I found that the second lumbar has been the primary one that got injured here when she lifted the copier. And she actually has a base posterior sacrum.
You want me?
That's right. Tender here.
Yeah.
And here.
Not as much.
Okay. Let's see the extension. How about this?
Oh, that's sore.
That hurts.
Yeah.
That one's pretty good. 4, 3. That's pretty good.
It's that right there.
Yeah. And side bending this way. This way. See the lumps right there. Okay. The nerve supply to the knee comes from this area in the spine. It can be as high as 9 and as low as into the pelvis too. But on you, we found that this second lumbar here, 5, 4, 3, 2, and 1, you have 5 lumbar vertebrae, has tilted this way and rotated this way. And that rotation starts down here and carries all the way up into here, all the way up. So some of this, there's a predisposition to hurting when you turn that way. So that's already a setup for that. So this one right here, this come back and down, and this turned, and it's actually kind of up on that left side. And that nerve runs out and down, and it goes into the knee, down into the knee there. So that needs to be adjusted and get the pressure off the nerve from that. And this can contribute to it too. This ilium is turned this way, and when it turns out like that, we call it an externally rotated right ilium. And when that happens, that can contribute to the knee's not tracking right too. It'll carry over into the left side. That's part of why it starts switching sides on you. Because as this gets better, it can start to switch sides. And when this starts to correct out, you may get pretty sore up in here. Because this is opposite. This is wedged this way, this is wedged this way. If this will start to correct, this might get a little worse up here. And that's old injuries up there.
And then on here, where is the thoracic that you're talking about?
Right in here.
Oh, up there. Okay, so
Right
higher than I thought. Okay.
Now these got a little wedge shape this way. The rectangular part of the bone there is called the body of the vertebra, and it actually kind of collapsed a little bit about 10 or 15 years ago, and then it stabilized. Got a little just like that.
Good. Good
Got a
one.
little sweat response on that too. See?
Yeah, I heard it.
Push it up like
And I
that.
felt it. Oh, good.
Yeah.
Okay, I'm gonna walk. Yeah, and the room is crooked,
Uh-huh.
so that's a good sign, right?
Yeah.
Yeah. Okay, I'm gonna walk.
Walk that off a
Okay.
bit.
That's good. That feels
Gotta use the
good.
knee off too.
Yeah, a little bit, for sure. Maybe you don't have to check my knee. That one's
I
sore.
think when she turned with that copier, she turned this way. And we x-rayed the knee, and the tibia is actually turned that way. So the adjustment on that is straight this way. And you just,
Ow. Sorry.
Yep.
Ow.
and you know that these hurt. A little bit. Like that, just like that.
That wasn't
You
good.
can also do it this way, but that's been the best way on her. And then walk on that.
Okay. It's like
Yeah.
tingling, which is good. Oh, okay.
There you go.
Oh, that's better. All right. That's good. That should help.
Hey, you walk easier.
Yeah. Thank you very much.